We're going to get rid of Obamacare, repeal it, and replace it. It's caused soaring double-digit premium increases, and we're going to give choice to patients and to consumers across our land. Aetna just today announced that they are dropping out, as are many of the major insurance companies. Obamacare is a disaster. It's a disaster.
Donald Trump on the stump earlier this week in Wisconsin, saying he is ready to flat out eliminate Obamacare. The candidate's comments come as another large insurant leaves the Obamacare market exchanges. According to our parent website, Newsmax.com, the insurer, Aetna, is leaving 11 of the 15 states where it had been participating in the program due to persistent and profound financial losses. For more on this story, we're pleased to be joined here on the anchor desk by Newsmax health editor Nick Tate. Nick is here to talk about this, and we should also point out that a book that's very timely to our demographic group, your Baby Boom Survival Guide, technically DaVinci's Baby Boomer Survival Guide, is still available. And I've got to bury my nose in one because we're of a certain age. And we're a certain time in this country where it looks like Obamacare is if not on life support, sure is on a lot of taxpayer-supported dollars now.
Well, with Aetna pulling out, they've now become the third major insurer in the last couple of months to come out of Obamacare, behind Humana and United Healthcare. Those are three of the biggest ones, and Blue Cross Blue Shield is certainly likely to be far behind. Sadly, what this means is that the insurance company is telling us, the insurance companies are saying that it's unsustainable, they cannot sustain the losses, and sadly what it means is for about 250,000 Americans who've been getting insurance through these three companies, they're going to be looking for new insurance. Remember the president who said if you liked your health insurance, you could keep your health insurance? Not so for those folks.
And the other was, if you like your doctor, you can keep your doctor. So now you don't have your doctor.
Right.
Now these guys who were sold this don't have coverage.
That's right.
And it does set up in this campaign year the question of what is next, because you know, you wonder, Hillary probably is going to take us what, down the road to a single payer if she gets elected?
She has said basically that she supports Obamacare, and in fact she wants to build on it and expand it. So what she would like to do is expand Medicare to people who are 55 and older as opposed to 65 and older. She wants to provide health insurance through the Obamacare exchanges for the 12 million undocumented immigrants in this country. So the idea is, with Hillary, we're going to get more of the same, it seems. There is some talk she's made to holding costs down, but we haven't seen how. The question is, what's the alternative? Donald Trump has talked about repealing Obamacare, but we haven't gotten many details on what he would replace it with, and I think that's the question. But regardless of whoever ends up in the White House in January, the costs for Obamacare and health care in this country are going to be a major problem that next president is going to inherit, and is going to have to do something about it.
So does this become fiscally like the state I used to represent? In my old district, we had Meteor Crater, you know, where you could go see where the meteor hit. I mean, what are the long-term financial implications? Sure. Because you just can't snap your fingers and go, oh, all this money that went down the drain, no big deal. I mean, we have to dig our way out of this.
Of course. Well, you know, the healthcare system, as such, is based on insurance companies providing coverage for people to get the care they need, doctors delivering that care, and hospitals providing that care in a way that they can make a profit, or if they're nonprofit, at least become financially solvent. What's happening with Obamacare is all three of those things are being affected, and the bottom line is that consumers are paying more and they're having fewer choices. Just this week, the Department of Health and Human Services came out with a new report that suggests that the average increases for premiums in 2017 nationwide are likely to be about 11%. That's 3 or 4 times the rate of wage growth in this country, and more than they were on average before Obamacare was passed in 2010. Now, the whole idea of passing the Affordable Care Act and calling it the Affordable Care Act was to make care affordable, and where we are now is the rates are higher than when we started.
Silly me, I thought it was bait and switch, which is what it turned out to be, because here's the alternative. We passed it when I was in the Congress. Medical savings accounts, where you have a high deductible for those catastrophic events that we can have any time in life, and then you're able to take cash and put it away tax-free. And then you become, and I know this is a bad word when it comes to health care, but you become a consumer. You take a look at what fits my family budget rather than having a bureaucracy run it. Well, go ahead, sir.
Well, here's the hopeful thing, I think.
Okay.
The HSAs came out of the debate over Hillary Care, right? So they were Congress's response. They were a conservative idea that came in response to the shoot down of Hillary Care. So my hope, and I can be a dreamer maybe, but my hope is that what we will get as the debate continues on Obamacare is the smart solution that solves some of these problems. What's ironic is that Obamacare actually lowers the power of HSAs and limits how much money you can set aside, making those catastrophic plans not as attractive. It also lowers the amount of money you can put aside pre-tax through flexible spending accounts. So we really need to get back to the point where if you're putting money aside and doing the smart thing for your health to save for a rainy day, you should be rewarded and not penalized. But we're not there yet, because what we have are the extremes on both sides saying repeal without a replacement alternative, and the folks on the other side saying it's perfect, don't fix it. My opinion is if we made 3 or 4 or 5 big changes right now while we continue to have the repeal and replacement discussion, it would hold down costs and expand consumer choices. But I don't see that happening in the gridlock in Washington.
Well, the most extreme thing that can happen, the handwriting's on the wall. If the left stays in charge at 1600 Pennsylvania Avenue and gets more help, boom, single-payer health care system, full-blown socialized medicine, and that is not what the doctor ordered, for my opinion. Now, let's turn to another story.
Sure.
Zika.
Yep.
You have been tracking this. In Florida, health officials are investigating 3 more suspected non-travel related cases in Miami. That brings the total number of locally transmitted homegrown cases to 33. In addition to that, the Sunshine State has reported 12 new travel cases. So, for those living in Florida, does that mean we're going to see it beyond the boundaries of the state of Florida, throughout the state, and perhaps in the lower 48 pretty soon?
Almost certainly. I mean, Florida, in some ways, is the kind of canary in the coal mine here. We're seeing the leading edge of these locally transmitted cases, which means that individuals haven't gone to some foreign country, a third world country, and picked up Zika and brought it back into the U.S. But it's local mosquitoes that have it. Local mosquitoes are spreading it. And in characteristic fashion, we've got nothing happening in terms of action in Washington. We've got gridlock that's locked up the money that would keep these cases low and keeping it from spreading. Sadly, I think the summer of Zika is going to give way to the fall of Zika, and many more states are going to experience these cases.
Well, let's take a look at the weather right now. Louisiana, with the floods, you can look at that and see suddenly the Bayou State becomes a huge Zika state.
No question. Florida, Louisiana, watch for the bloom in the cases that are going to come. And sadly, I think there's also going to be a range of births next April, next May, that will come 9 months after these months, where we will see children born with the birth defects that we know Zika causes. I think Louisiana is absolutely going to be a place to watch. We need to be focused there and getting help to those folks and knocking those mosquito populations down.
And to do that, they're talking about genetically modified mosquitoes.
Well,
is that practical?
Well, it's a little late for that, number one. Number two, the knock on genetically modified mosquitoes is they may, in fact, knock down Zika, but they could also introduce unexpected consequences that may not be so good for the environment and the populations there, too. This is a case where we've waited so long to do anything, like with Ebola, like with recent flu outbreaks. We need to get on top of these things and prevent and not respond in these huge, over-the-top ways that we're going to have to.
Only got about 30 seconds. What should people keep in mind? How do we protect ourselves?
Well, this is very simple. It's not sexy, but you need to reduce your exposure. Don't go out at night. Don't go out at dusk when mosquitoes are biting. Wear repellent. Wear long sleeve shirts and pants. Reduce standing water. And we have on the website a guide to the repellents that work best against the mosquitoes that spread Zika. Pay attention. Protect yourself. Don't wait for the government to do it for you.
And again, our website where they can find that.
Newsmax.com/health.
Newsmax.com/health. Music to my ears and practical public health information, too. Nick Tate, author of DaVinci's Baby Boomer Survival Guide. Thanks for your tips on surviving both Obamacare and Zika, and goodness knows what else is coming down the pike. Now, in terms of clairvoyance, I can only confess to this. Our time tonight is over. I'm making plans to see you here again tomorrow night at 8 o'clock Eastern. Till then, stay brave, stay free, stay tuned.